Hey everybody, how you doing? We are here at TriStar Stonecrest Medical Center in Smyrna, and a lot of you have been writing in asking a whole lot of medical questions about what's going on with coronavirus and COVID-19 and how hospitals are addressing this and things, just all kinds of questions that I'm not a doctor, I don't know the answer to. But right next to me is Dr. Shook, who here at TriStar has been gracious enough to donate his time, thank you, to sit with us. But also I want to say before we get into this, if you don't mind, we had to go through quite a bit of protocol to get in here. So just want to let you all know we've seen no patients. We had to go through all the proper procedures to check in. We got our temperatures taken. We all have masks. All the people behind the camera you don't see all had to do the same thing. So we are in now a hospital classroom away from everybody so we can get to it. So just wanted to throw that out there so y'all don't worry. We're not around any patients. So there you go. So thank you, by the way, for spending time with us today. Appreciate it.
Happy to do it.
And I'm just going to dive right into these questions if you don't mind. So, and we had quite a few people write in, so just going to jump right to it. So David Hawk was the first one, and he just wants to know the difference between the mask versus no mask. I know there's a lot of debate going on about to wear or to not wear the mask. So.
Right. Still definitely, short answer, safest bet is to still wear a mask. I mean, there's a good amount of data worldwide that shows that your risk of transmitting to other people and from getting it by droplet, which is how COVID is passed, is best protected still through having a mask. And
Okay.
lots of hand washing too.
Lots of hand washing. All right. Okay. Wonderful. Thank you for that. And thank you, David, for the question. This next one's kind of a branch off that one from Heather Robinson. Thank you for your question. I actually have seen this quite a bit. People are wondering if they are, with wearing the mask, are we doing any damage through breathing in carbon dioxide?
The answer is definitely no on that.
Okay.
Every time you're breathing in, you're entraining a lot more oxygen. So that ratio of oxygen to the carbon dioxide you're putting out, there's no evidence, not only by our own recent experience, but there's a lot of studies from like the 80s and 90s when that was tracked in surgeons, and it shows that there's no change in their actual oxygen level in their body.
All right. So that's just an urban myth. People don't need to worry
Exactly.
about it.
Exactly.
All right. Wear your masks. All right. Thank you, Heather, for that one. Going on to Jessica Bassett. Thank you, Jessica, for your question. She just wants to hear how you feel the pandemic has affected normal people who would normally seek treatment. Like, are people staying away that would normally seek treatment through a hospital? Or are you seeing less patients come in? Or
that is a great question, Jessica. That's one of our biggest concerns, is that we're seeing from an ED perspective, folks are waiting longer, and what we're concerned about, and what we're actually seeing is that they're ignoring really severe symptoms, things like chest pain or numbness, signs of stroke. So we're seeing patients late in their illness when they're really sick, and so it makes it harder to really get successful treatment and better outcomes. So people need to come early when they recognize those symptoms that are severe.
Okay. So you got any symptoms, don't wait. Come in. Or now it's here, I'll just drop that anywhere. There we go. But you had mentioned something about telehealth as well. People can they do that as well?
We are, during this serious part of the pandemic, we're using telemedicine, telehealth quite a bit to be able to see more patients safely, because again, it allows you to do that without it being in close contact.
Okay.
And so we're continuing to look at those options now and in the future. So It's been a great tool for us, yeah.
Okay. All right. Wonderful. Thank you, Jessica, for that question. Next one comes from Natalie Womble. I apologize if I said your last name wrong. But she said, do you personally have any advice for the community to help reduce the spread now that restrictions have been loosened? Like, do you still, other than what the CDC and the WHO have put out?
Nothing really that supersedes anything the CDC is saying. Obviously, a lot of folks are fearful as you begin to reduce social distancing and people start coming together. But again, the same old things we've always practiced for universal precautions around washing your hands frequently, still wearing your mask in public places. I mean, that is still the national guideline for good clinical reasons.
Okay. All right. Well, thank you for that. Next one comes from Heather. She has a couple questions here. She wanted to know, do you have any COVID patients now? If that's something you can disclose, and how many on ventilators, and have you seen an increase now that things are starting to open back up?
Oh, so that's multiple questions.
Yes.
So yeah, we do. We currently have some patients that are COVID positive. None are in the ICU or none are on ventilators currently.
Okay.
We've certainly seen that number peak previous weeks and come back down and reduced over time.
Okay.
So we're very happy about that.
Okay. Just another one I didn't write down. I saw this come up a few times. Do you think the peak in the numbers is due to restrictions being opened up and more people maybe spreading it, or is it the fact that more people are getting tested, or is it a combination of the both?
I think it would be very difficult scientifically at all to say it's related to the more recent social distancing reduction, but it's clearly based on testing. The availability of testing has gone up 100-fold in the last 6 weeks, nationwide, not just Tennessee. So as you test more people, you're going to pick up more people that may either be asymptomatic or have mild symptoms. So that case number will continue to rise as we test more people. And so the number of deaths is, again, that is a real number. That's the number that we're obviously most concerned about, hospitalizations and deaths. And that number has continued to rise, but has followed models very closely, especially very much in line with the HCA-based models that we've seen.
Okay, all right. Well, wonderful. Thank you for that one. Ms. Audrey Hirschberger, just simple question, just wants to know how many designated COVID beds you have here.
We have COVID areas or COVID units that we can flex as few as 8 to 10 beds up to 20. We've designated certain areas of our units and certain areas of our ICU as well that are what we call negative pressure. They're the safest areas to have patients that may be either suspected of COVID or actually have it. So that number will flex and change, but as always, all the precautions are in place before we utilize those rooms for COVID patients.
Okay, gotcha. All right, thank you, Audrey, for that question. Next one is from Amy Dorsch. I apologize if I said your last name wrong, Amy. But she just asked, are non-COVID areas fully operational, limited, or shut down because of COVID right now?
Again, like any facility, any hospital, as our volumes had decreased, some areas were not being utilized as often. I won't say they were completely shut down, but we always made sure and continue to make sure that those folks that are at risk, that are suspicious or positive, are cohorted or away from the patients that are not. So some areas, those areas that we've changed utilization of some of those areas to better serve the COVID patients.
Okay, all right, makes total sense. Thank you, Amy, for that one. Next one is from Jay Sloan, and this is it's a straight your opinion question here. As you put, wants your opinion on the way that places are opening back up. Do you think some places should versus some places shouldn't? Why or why not?
That's a very interesting question.
Yeah, it's kind of broad, but
I think that everything needs to be based on science. I think that as we look at the number of new cases that are being seen per capita, not just number of tests, but the number of new cases that are being seen in patients, the number of hospitalizations, ED visits, and based on how sick patients are, that's how decisions can be made regionally and in certain areas where you can safely reopen. And I think that's as long as we govern all that and direct it by science, knowing what the actual incidence of new cases are, and the overall prevalence, that's how we can best make those decisions.
Okay, all right. Thank you, Jay, for that one. This next one's from Dana Malone. She was curious, have any doctors tested positive that you know of? And I'll leave it at that one. Have any doctors been tested?
There are doctors physicians throughout the area and region that we know have been tested and been positive. Again, it's from a perspective of symptomatology, we've been blessed that we've not had anybody that's had anything beyond mild illness. And so again, just to follow up from a safety standpoint from our patients, those docs, of course, follow all the CDC guidelines, are quarantined and kept from work and are not exposed to patients during that period.
Okay. Another question from Donna was that she just wanted to know have routine surgeries changed at all, and if so, how?
Absolutely. So we at TriStar Stonecrest followed the same processes and same guidelines from the governor and nationwide to reduce or eliminate basically routine or elective surgeries for a period of time until such time that we saw that the COVID pandemic and the COVID incidents started to go down. Again, we're following the CDC's guidelines, American College of Surgeons, and Governor Lee to only return to routine or elective surgeries, which we've done only very recently, making sure we've maximized all the precautions for patients.
Okay. All right, well, thank you for that. And thank you, Donna, for that one. This next one is from Jean Reed and was just curious if there was a definitive time that you know of where hospitals will open back up so they can have more than one person in at a time to, families during surgery, that sort of thing.
Absolutely. That's that was a source of great stress for families. As you've seen, us here, we saw firsthand, but also nationwide. We've already liberalized our visitor policy in the last couple of weeks to allow one visitor, per patient. And we'll continue to monitor that and follow the best practice from the CDC and from our own internal HCA modeling, where we look at incidence of disease, making sure we're maximizing protective equipment with our providers and with our staff to protect folks as they come in. Caveat, still will always be screening those visitors as they come in. If they're positive, it would not be best practice to allow them to come in the facility.
Okay. All right. Well, thank you for that, and thank you, Gene. Coming up on the end here, Miss Amy Pillow, she had a couple questions, so I'll just do these in order here. She said, are there what type of precautions are being made for the women coming in having babies?
It's a great question. Also, same thing, screening, making sure we're screening all visitors. We, obviously that again was another source of difficulty, not having those moms to have a supportive caregiver with them, be it husband, spouse, or parent. We've liberalized that so that there's one person allowed, one visitor to support them and be here with them for that process and delivery. We'll continue to look at that. We make sure that they're all screened as they come in. And provide protective equipment, basic equipment for those visitors so that they're protected.
All right. Well, I think you just answered your second one. It says how many visitors can they have? So you're going to have one visitor
Yes.
as of now?
One support person as of now.
Okay. All right. The final question from Amy is that she just wants to know, has the staff as a whole around the hospital, has everybody been tested for corona?
So no, the short answer, they've not universally been tested, but we have a very strict screening policy and protocol. Every shift, every day, every employee is being screened using the national screening policies from CDC and our own that match up. Includes temperature screening and risk screening. And then should they be found to be positive either by screening, they're appropriately tested. And then of course we follow a very strict policy around quarantine and restriction of duty.
All right, wonderful. Thank you, Amy, for those questions. Now I saved this one for last. So I read this one from Samantha Cuff, and I was just ready for this one. So you ready?
All right.
And this is
Fire
just your
away.
opinion, just
Okay.
straight your opinion. How over-dramatized has the media made all this?
The short answer, I think, is that the media attention is important to be able to give information to folks and to have a better understanding of what's going on in the community with COVID-19, its transmission, and how to prevent it. That being said, opinion only is that there could be, I think there's some sense at times that there may be a little bit of a misdirection or misfocus on what's being where the media is being most attentive to certain things.
I gotcha.
That aren't as significant and maybe just more alarmist.
Okay. Gotcha. Well, thank you for that one. That's a straight opinion question on that one from Samantha. That was my last question. Thank you for everybody writing in on those. But if you would, I know we spoke earlier about what policies the hospital has now because things have changed. If you don't mind just talking to our readers for a little bit and just tell them what the hospital is doing now, how things have changed, or what you see coming.
I mean, I think our biggest changes clearly would be around our visitation policy, making sure, we're now, again, following the incidence of disease has been decreasing regionally. We are now allowing one visitor, again, per patient, and that's a huge thing, obviously. They're still screened on entrance, and appropriately so, and then given protective equipment during their stay here. And then, again, the second piece of this, what we've touched on, was our refocus on reducing pain and suffering in patients by reopening up to elective surgeries. And so when we say elective, these are surgeries that aren't emergent or needed today, but these are still folks that are in pain or have chronic disease that need these surgeries. And so we're continuing to monitor that and make sure we're also protecting those patients, their visitors, and our own staff, making sure we're following strict policies around testing and screening for COVID so that those folks are appropriately treated and cared for when they come in. Again, one of the things I like to remind folks is our clinicians, our nursing staff are all expertly trained in prevention of infectious disease, whether it's seasonal flu, whether it's TB, whether it's COVID-19. We've learned a great deal in the last few months about COVID-19, and so we've gone great lengths to put policies in place that protect the providers and, most importantly, also the patients.
Well, that was wonderful. Well, I really appreciate your time. Thank you, Dr. Shuck, for meeting with us and going over all those questions that we had. And I do want to invite everybody watching out there, the wonderful people behind the camera that you don't see said that if you put enough questions in the comments, we can come back for round 2. So thank you, by the way. So if you have any more questions, put them in the comments below, and we'll come back and do another round of these with you if you don't mind. So thank you very much again for your time. And thank you all for watching. As always, we appreciate it, and you all have a great day.